Said to discuss about basic nursing care. We all nurses. I hope we all knew basic nursing care and all. But in palliative care, this is a very very important topic. So this session will be taken by Mr. Sajan, who had already taken a session for us that is on subcutaneous infusion. Sajan, welcome back and over to you.
Thank you, ma'am. Okay, good evening to all. Once again, I am Sajan V S. Today, I would like to introduce and I would like to share some of the point, including in the topic, basic nursing care in bedridden patient. As we all know, uh, as we all know, mainly if one patient or one person is have the capability to do the self-care activity means they will do. If any assistance also needed means also occasional assistance only needed for that person for doing their self-care activity. But in some cases, patient became terminally ill and patient became bedbound, totally bedbound or totally bedridden cases means they need to get all the care from support of others. That time we need to give some of the care for that bedridden patient. Why we need to give the care for those bedridden patients? First one, already the patient in bedbound stage only. So periodical continuous giving of care, by that we can prevent the health complications. Already the patient is in sick only. Further complication in their health status we can prevent by giving the periodical care. Then promote comfort for the patient also. Patient will feel the comfort and the confidence level also will build because they are now the patient is unable to do their self-care activity, but with the support of others or others will giving the total care for the person. So the person will feel the confidence level also there building very much and prevent the isolation feeling also. Suppose the patient is lying in bed in a single room, if suppose the patient family members or caregiver is not at all giving any care or not at all visiting in between the person means person will feel the isolated only in that room. They are totally isolated, nobody is taking care about me or nobody is thinking about me, nobody is there for listening me. Like that isolation feeling the person or patient will feel. But periodical care giving means that love and affection also the patient will feel from the caregiver side and prevent the isolation feeling. Then quality of life also improving up to the end of life or up to the death. The patient also have the dignity and patient also have the right to get the or maintain the quality of life. So by giving these are all the care, by we can improve the quality of life also for the that person. What are all the basic needs of the patient? Means these are all the care. Suppose a bedridden patient we handle it means these are all the care we need to give for them or they need to get this care. Oral care, skin care, eye care, ear and nose care, hair care, perineal care, nail care. For this all care, we are going to discuss more. First one, oral care. Oral care, we can tell us it's an overall health because in digestive system, first process is starting from the mouth only. while the food intake time, the oral hygiene is not at all having means it will cause the further infection to the internal digestive system also. So the oral care and oral hygiene is very much important, mainly in the bed-bound state because patient is unable to do by self. Why we need to give the oral care for the patient? Mouth actually we can tell is a medium for growth of a bacteria. It's a excellent, can tell us an incubator for the growth of bacteria. It's a medium. So the oral hygiene practice help to maintain the healthy status of the mouth, gum, teeth, and lips, everything. We can maintain the health. Or otherwise, the inflammation and infection happening in inside the mouth, in gum, teeth, tongue, lips, at any space, any infection is happening means also it will to the leads to the problem. So while doing the oral care or oral hygiene, we maintaining time. In between, we while cleaning, we removing the food particles that may be likely media for the bacterial growth. Continuously occupying the food particles inside the mouth in between the teeth or in between the gum side means it will cause the decaying of the gum and decaying of the teeth also. So removing of the food particle after the food intake is very much important as a part of the oral care. Then to keep the lips and the mucosal layer also very clean, soft, and moistened. Because in dehydrated state means the over dehydration, the dryness will cause the infection and the further ulceration also it's a cause. So to keep the lips and the mucosa very soft, clean, and intact and moist also, we need to ensure about that. Then promote comfort. Patient also will feel the comfort. So it's a freshness feel patient will get after the oral care. Then nutritional status also we can improve. The fresh feeling of the inside the mouth, if the patient feeling means also patient have the like to take the food and good appetite also will induce and patient can take likely food. Then in between the oral care by if we doing the oral care by using brushing means in between the massaging effect for the gums will get patient will get and maintaining healthy firmness also for the teeth also. Strengthness of teeth also will get and gum also the blood circulation will increase by the stimulation. So a good health for the gum and the teeth also. Then in between the oral cleaning and oral hygiene maintaining means it will helpful for the eliminating for avoiding the unpleasant odor, any bad smell, foul smell if in between happening that episodes we can avoid by periodical oral care. Then dental caries also we can prevent. Already I told continuously deposition of food particles in between the or superficially on the dental means it will cause the dental caries. So dental caries also we can avoid due to by the oral care. Then what are all the common oral problems we need to we are going to face or we need to prevent or we need to manage? First one, dry mouth. Dry mouth means even if the patient is having that much a dehydration state also or otherwise patient is not at all taking any fluid by orally, at least sips of fluid also patient is not at all taking by orally means it will cause the dryness of mouth. So this dryness of mouth gradually will cause the painful feeling of painful in the mouth and small cracks will feel on the tongue, lips, in between the mucosal layer, some cracks will happen due to the dryness of mouth and it will cause the pain for the patient. Then halitosis, foul smell, while breathing time also will feel the malodor will feel, that's the halitosis. Then candidiasis, candidiasis or oral thrush, it's a fungal infection only, patchy like appearance will we can see on the upper portion of the tongue or inner palate. So this candidiasis also will happen due to the poor oral care. Then oral mucositis. Mucositis means some edema feeling and redness and the inflammation sign also inside the mucosal layer, tongue, or in between the inside the cheek area, any area, the inflammation sign will happening means mucositis. That mucositis also the painful for the patient. Along with that, patient cannot be able to take food also by orally. Then alteration in taste. Continuously the oral thrush is there means, or other any ulceration is happening continuously in tongue means it will affect the taste buds. And due to the affection of the taste buds, patient is unable to take food due to the dislikeness, due to the taste difference also will happen. Then excessive salivation also. Excessive salivation also it's a problem. Then these are all the some of the pictures I'm showing. Xerostomia means dryness only, dryness of the mouth, painful mouth. Then second one is the candidiasis or oral thrush. These are all the pictures for the oral thrush and candidiasis. This one is the mucositis. Already I told inflammation sign. Is having edema and redness and very much painful situation also for the patient. Then, who needs the mouth care? Mainly, first one, terminally ill patient. Patient is continuously in bed-bound stage. Patient is unable to do the brushing or in between gargling. It's not at all possible because patient is mainly in bed-bound stage only. So the terminally ill patient means also we need to give the oral care for the patient. Then unconscious patient. As you're all unconscious means also need to take care about that patient. Then patient is continuously taking breath by mouth. Means mouth breathing means also it will cause the continuously air entry, atmospheric air only they are taking by mouth. So oral dryness will happen. This excessive oral dryness will happen to the xerostomia. Already we discussed dryness of mouth and painful mouth. It will happen. Then post-operative patient. If this type of patient is not at all in stage of terminal ill, but post-operatively now the patient is in the stage of immobilized state. So patient is unable to do the brushing and other activities by self. With support or major considerable assistance he or she needed for his or her activity. In such spaces also, due to the immobilized period, the poor oral hygiene is happening means it will cause the problem. So post-operative patients also needed the oral care. Then patients with infection and disease of mouth, already the mouth having any ulceration or any infection in gum or teeth, dental caries, anything, already if the patient is having means also in between the oral care is not possible because already the patient be feeling pain. Again, the stimulation and other modalities will provoke the pain. So patient will avoid. So these type of patient also need the steps for the oral care. Then already the patient is in nasogastric tube feeding or NG, Riles tube feeding, already the patient is getting means majority of the caregivers very well they are managing, they are feeding very well by nasogastrically, but already the tube is in through the nose only. Inside the mouth, what is happening, the caregiver not at all have that, never bother about that. So we need to educate them or we need to practice proper oral care for the nasogastric patient also. Feeding by tube only, but oral care we need to maintain. Otherwise, it will cause the further infection and it may will cause the systemic infection also. Then, as like every symptom, here also some assessment we need to do. First one, already we discussed, any cracked lips we noticing is there or not. If anything is happening means we need to do the management. Then dried or coated tongue we noticing or not, we need to assess. Then white curd like patches on the layer of tongue is there or not. Any mouth ulcer, lesions, anything is there or not, we need to assess. Then any bleeding sign, bleeding spots, any redness is there. Mainly in mucositis means we can expect this type of redness and bleeding. We need to assess about that and according to the assessment, we need to manage. Then patient is only reporting any pain in the mouth is there or not, we need to address. Then we need to find out the reason and we can manage. Then any dysphagia or change in taste of food. Patient is saying us painful swallowing, or patient is feeling the taste is just changed. Like that, anything is patient is saying or not. Maybe due to the oral thrush or oral candidiasis also. Superficially, the tongue may will now our assessment having the oral candidiasis, but maybe it will extend to the inner side also. Inner digestive system also may will it will increase. So we need to assess on that and we need to do the management. Then any chewing time, any difficulty, especially swelling or not, we need to assess. Then anorexia. Already the patient has the ability to take food normally, a good food intake he or she had. But now patient is reporting the anorexia. Like that, any episode is there or not, we need to assess. Then any unpleasant smell, foul smell, or any halitosis we facing or not, we need to assess. Then any medicines. Suppose if the patient is taking any continuously on oral antibiotics, maybe due to the prolonged use of the antibiotics, such type of medicines also will cause any ulceration, or due to the overheat and due to that some lesions or ulceration may will happen inside the mouth. Like that, any history is there or not, any medication history is there or not, any allergic history is there or not, we need to assess. Then any treatment history, any chemotherapy or any radiation, already the patient is getting or not. Maybe the radiotherapy already, if the patient is getting mainly in the head and near to the face, neck, up to the neck region, we can expect at any time these type of lesions and this type of redness may will happen inside the mouth. So due to the radiotherapy or due to the or any oral chemotherapy, like that, any treatment modality related with the oral problem is there or not, we need to assess. Then for this oral care, we need some solution also. Mainly we are using two type of solution. First of all, water or sodium chloride. Mainly commercially available 0.45 to 0.9 percentage containing sodium chloride, normal saline we can use. But in home setting also, this type of care we can educate the caregiver, so we can educate them how to prepare the homemade saline. So homemade saline, how it's preparing means 500 ml of water, and we need to add 1 teaspoon of common salt in that and boil it for some time up to the boil, complete boiling. Then let it cool and keep it as a covered until it's needed. We need to educate them also how it's practiced, and they can use this homemade saline for the oral care. If the patient is able to gargle means this solution we can give to the patient for oral rinsing and gargling. Then suppose if the patient is bed bound, we need to give the care means we can use this solution and we can give the oral care for the patient. Then other option is a sodium bicarbonate solution. For the sodium bicarbonate solution, same only 500 ml of water, but it's adding 1/4 of 1 teaspoon of baking soda. This we can add it and we can use it for the oral rinsing and the gargling. Mainly the soda bicarbonate solution, mainly we educating the patient to take mainly in the case of the oral thrush. Mild to moderate oral thrush, if the patient is having means also, we can promote them to use this type of solution for the oral care. Along with that, any topical application of protonmaxol, anything is we need to add means we can add. Then already I told, if the patient is able to do the oral care by self, means we can educate like this. We need to promote them to brush the teeth twice a daily, 2 times daily. They need to brush in morning and night time. They need to brush. Then in between, after the food intake time, also they need to clean. But brushing, we can encourage them twice a daily with a soft toothbrush only needed. if hard bristle toothbrush they are using means it will irritate the gum. Already, if the gum have any problem, there means hard bristle using toothbrush is patient is using means it will promote the bleeding. So toothbrush should be the soft only. It will give one massaging effect also for the gums. It will give the firmness for the teeth also. Then, if the patient is using the toothpaste for the oral care means uh, completely cleaning, we need to ensure. We need to educate them because if the toothpaste content is left in there means it will cause the dryness. So we need to ensure that. Then for the proper cleaning, rinse the mouth periodically. If the homemade saline or soda bicarbonate solution is needed means that solution also we can promote them to rinse the mouth in between. Then 3 times a daily or 4 times a daily, according to the scenario, we can educate them. Then already for the tongue cleaning, same soft toothbrush only they can use for brushing the tongue also. Then plenty of fluid they need to take if the patient is possible means because dehydrated case means it will increase the dryness of the mouth. So for the rehydration or maintaining the fluid balance in our body, if the patient is able means take plenty of fluids. Then pineapple contain on enzyme, it will give a cleansing effect to the mouth also. So in between the piece of pineapple is chewing or taking is very helpful. It's a patient is like or it's a capable means they can take the pineapple. Then it will give the salivary stimulant action also. So in excess, not excessive, proper salivary secretion is happening means also we can promote the moisturizing effect in the mouth. Then if the patient is using the dentures means should be removed at the night time. Night time they should be removed and keep it in a clean container. Next day and daytime they can use the dentures. Then if the patient need occasional or considerable assistance for taking care about the oral care means. First one, as like every procedure, we need to explain the procedure to the patient, what we going to perform. That is the importance to doing that because already the patient is in a lying stage only. From there, we need to maintain the position. We need to change the position. We need to stabilize the position throughout the procedure. So it's importance we need to explain to the patient or otherwise the patient will refuse to do this activity. So we need to explain the procedure to the patient, then provide adequate privacy also for the patient, then provide semi-fowler position or fowler position is possible means fowler position. If it not contraindicated or if it possible means we can give the fowler position for the patient. Then on cardiac table or any supporting equipment is there, it's possible means we can give. With that support, we can make to sit this patient in like this manner. Then before doing the procedure, we need to place on towel under the chin and over the bedding also for avoiding wetting by water. Then pour the water over the brush and place anything, any dental using any powder or any toothpaste at any patient, whatever may be, we can use it on the brush. Then after the brushing, proper brushing, in brushing time, we need to ensure it's a soft gut. After the brushing, encourage the patient to rinse his mouth frequently and periodically because need to clean thoroughly the oral cavity. So not only the concentration in the procedure, after the brushing procedure, we need to ensure the patient continuously and frequently rinse that cleanse his or her mouth very thoroughly. Then remove and clean the equipments, wash our hands also. Then document the time. Any solution we already used for the oral care means we need to chart that solution, which solution we used, and it's a reason we need to just chart. And in our assessment also, condition of the oral cavity before the procedure and after the procedure, we need to assess how much benefit a patient get. by the procedure. We need to chart that also. Then third on procedure for a terminally ill patient, because patient is now completely bedbound. Considerable mainly assistance needed for these patients for the care. In hospital setting and home care setting, both setting we can tell like this. In hospital setting means artery forceps, first thing, artery forceps. Artery forceps mainly we can use for holding the cotton balls or gauze piece, anything holding. For holding, we can use the artery forceps, or otherwise any tongue depressor. Also, tongue depressor for making to open the patient mouth. For that, we can use the tongue depressor. But in home care setting means we can educate them to use the spoon or ice cream stick. Means that spoon, while using backside of the spoon, we can use for the procedure. Just hold the spoon in a reverse manner, and the backside of the spoon we can tie it on gauze piece very safely, and we can use for cleaning, or otherwise the ice cream stick. Then we needed gauze pieces, then normal saline. In home setting means clean cotton cloth or any gauze piece available means we can use. Then for the normal saline, in homemade saline also we can use in home care setting. Then for waste dispose under the chin area in hospital setting means for avoiding wetting we can use the small Macintosh. Then in home setting means they can use the plastic sheet. Then on face towel also we can carry for the cleaning the face after the procedure. In home setting same only. Then after the procedure for the further periodical cleaning, clean water also we can use. Then swab stick also we can use. Then for the waste disposal, kidney tray we can use. Actually, this here on swab stick means on lollipop like one thing is there. It's that sponge like appearance that swab stick. This actually we can buy it from hospital. Commercially, we can get from the medical store, or otherwise by online we can purchase this type of lollipop like swab stick. So this stick also they can use for cleaning the oral cavity. So by using this type of lollipop like swab stick or already prepared spoon backside already prepared the tied cotton or tied gauze piece, that area we need to use for giving oral care for the patient. Then steps of the procedure. As like same procedure, explain the procedure to the patient and the family members. What's the importance we need to explain. Then provide privacy for the person. Then place a small Macintosh with a face towel under the head. Then semi-follower position and head turned towards our side. Or maybe taking care about the person that on that side, towards the side only, turn the head of the person. Then use a padded tongue blade to open the patient mouth and separate the upper and the lower teeth. For opening the mouth for a while for giving care, padded tongue blade we can use. Then already prepared that soak cotton balls in homemade saline and squeeze out excess water. Before giving care or before wiping inside the oral cavity, we need to squeeze out the excess water. Otherwise, it will cause the aspiration. Then for cleaning teeth, lower chewing surface, inner side and outer side of the teeth we need to clean, and upper chewing surface and inner side and outer side, both side, upper and lower portion we need to clean inside and outside of the teeth. Then while we cleaning oral cavity from proximal to distal area we need to clean. Means from medial line, midline of the face or midline of the teeth row, from there to right side, and from midline from there to the left side. So the proximal to distal area need to clean using each one stroke. For one stroke of cleaning, separate gauze piece or cotton ball need to use for clean the oral cavity. Then at last normal water also can use for same procedure. Again continue by using the normal water. After the proper cleaning inside the oral cavity for avoiding the cracks and dryness in the lips and the face, we need to lubricate the lips using the swab stick and the document the time. So already we have the plan to do the oral care TDS basis or 6th hourly. Any basis means we need to convey that. So we need to document the time while doing the oral cavity, any abnormality inside the mouth, in gum, teeth, or any mucosal layer, tongue, at anywhere, any unusual abnormality we noticed or not, we need to mention that. And the patient response also. Patient is comfortable with our procedure or patient is irritating. That the response we need to mention on that. These are all the common lubricants we can promote. First one, liquid paraffin, or otherwise can use a coconut oil, ghee oil, Vaseline. This type of substance we can use and we can promote them to apply on lips for avoiding the cracks and avoiding the dryness. Now we can just go through the video about the procedure of oral care.
Conscious patient. Mrs. Anna is suffering from brain cancer.
Then we can move to the second on care, care of eyes. So as like oral care, eye care also very much important because we need to avoid any inflammation and infection periodically for this type of patient. And dryness of eye also we need to avoid because otherwise it will cause the inflammation and the infection. So as like every procedure, same explain the procedure to the patient and the importance also we need to explain to the patient and family. Then provide comfortable position for the patient. Then hand washing is very much important. Then we need to clean the eyelid and eyelashes with wet swab. Don't use dry swab because already if the patient, the eye having the dryness or having the dried pus content, anything is there or not, we need to assess. If again we using the dry swab means it will irritate the skin or irritate the eyes, eyelashes also. So we need to use the wet swab for the proper cleaning. Wipe the lid from inner canthus to outer canthus. That direction only we need to maintain for doing the care of eyes. While wiping inner canthus to outer canthus, like that direction only we need to clean the eyelids. Then use each one stroke, separate swab we need to take for each stroke. Repeatedly same swab don't use for the wiping. So for every stroke, other swab we need to use. Then documentation also while doing the care, the assessment and everything we need to document. Then care of nose and ear. Same only about the procedure we need to explain and to actually we doing this care for the nose and the ear means we need to remove the secretion from the nostril. So wet washcloths or a cotton applicator moistened with the normal saline or water we can use for cleaning the canal, nostrils or ear canal we can use for cleaning. Then any dirt accumulation behind the ear. inside the folding of the ear, anything is there or not, outside or inside, is there or not. We need to assess anything is there means not only the canal, in between the space also we need to clean. Otherwise, the dirt deposition will cause the any skin irritation and itching feel also for the person. Then, while giving care for ear, continuous collection of wax in the ear also may cause the hearing problem and itchiness feeling for the person. Already the patient is maybe unable to respond or maybe in unconscious level. In such situation also, patient is continuously feeling of this type of itchiness means it will be the problem. So in between, while doing the ear care, we need to assess the ear canal also. Then hair care, care of hair. Same, maybe the patient, we can able to shift the patient from bed to bathroom by wheelchair or make to sit the patient in chair means okay. Otherwise, if the patient is continuously bedbound means at bed only we can give the care of hair. We need to explain the procedure to the patient. We need to help in bed means we need to help the patient move his or her head towards the edge of the bed. We need to remove the pillow. If the person is using the pillow means we need to remove the pillow, then make the patient to place his or her head at the edge of the bed. Then protect the bed linen and the pillow cover with a towel and Macintosh or any rubber or plastic sheet is available means it's on that towel also we need to spread it. So we need to avoid the water spillage and wetting on the bed and bed sheet. Then before hair washing, we need to insert the cotton ball also inside the ear. Then place a Macintosh under the patient head and neck. Keep one end of the Macintosh in a bucket to receive the water. Waste water we need to receive in the collection bucket. So wash thoroughly with the soap or shampoo, rinse thoroughly and dry the hair. Then after the proper drying of the hair, we can tie it safely. Can it possible means it's in two sides we can tie it safely. Then after the completion of the hair wash only, remove the cotton balls from the ear. Actually, we given the cotton balls in the ear because we need to avoid the water entry into the ear. Then another one, nail care. We need to explain the procedure to the patient. Every articles we need to arrange it in the bedside. Then here also, before doing the procedure, we need to place the rubber sheet under the patient hand or leg. It right or left, the under the hand or leg, we need to spread the rubber sheet for avoiding the bed wetting. Then soak the fingers in leg or hand. Fingers in warm water for 5 minutes because at the dried stage we doing the nail care, we cutting the nail means in some patient hardness of nail already if the patient having means the cracks will happen in the nail bed, so it will cause the pain and other issues. So for getting the softness for the nail tips we need to soak 5 minutes under the in the warm water. Cut the free edges of the nails and encourage the caregiver also provide the nail care. How the nail care is doing and importance also we need to explain to the caregiver also. Then bed bath. Bathing, actually normal bathing is a very important for maintaining health and promoting the hygienic also. So our main objective of the bed bath is to clean the dirt from the body. Next one, to increase the elimination of waste through the skin. Periodical cleaning of the skin on the skin means it will helpful for the elimination of periodical elimination of the waste through the skin. Then stimulate the circulation also. While doing bed bath, skin care, back care, that type of stimulation, if the skin is getting means, it will stimulate the circulation, then induce sleep also for the person, and we can provide the comfort also for the person. To patient also will feel a well-being, a freshness feel patient will get after the bed bath. Then body temperature also will can stabilize by the bed bath. Procedure, you need to maintain the privacy for the patient. Explain the procedure to the patient. Every equipments all are needed for the procedure. We need to arrange it in bedside only. Then temperature of the water also we need to check it before starting. We need to adjust the temperature of the water. Any warm water is using means also its temperature we need to maintain for the comfort of the patient. Then keep the patient near the edge of the bed to avoid if the caregiver, whoever may be, staff or caregiver also, while doing the care, that much bending of back is not needed for the activity. So we need to keep the patient maximum near edge of the bed. Then only small area of the body should be exposed at a time for giving the bed bath. At one time, needed part only need to expose. Then remove after applying the soap on the body, remove completely the soap particles from the body for avoiding the drying. Soap element is still there in the body, means it will cause the drying effect on the skin. So we need to thoroughly clean. Then cleaning is done from cleanest area to the less clean area, because in upper portion of the body clean first, then we can move to the lower parts. That telling from cleanest area to the less cleanest area. Then after the cleaning, after the bed bath, wash hands and feet by of the patient. Both palm and both feet, we need to immerse in a basin of water, because thoroughly we need to clean the wrist, palm, and feet, sole. These are all areas thorough cleaning needed. Nail, it's also we need to clean fingers and both fingers and toes. So the immersing these areas in a basin of water, then we need to thoroughly clean. Then a thorough inspection also we need to do on skin, especially back of the body, because patient is continuously in the supine stage, means we need to assess on that area. Continuously pressure prone areas we need to assess. Then pressures or any pressure prone areas already having any signs of the pressure sore is there or not, already having any skin peeling is there or not, any chance is there or not, we need to assess while doing this care. Then apply moisturizing cream also and give the back massage. Massage on the skin we need to give around 3 to 5 minutes. We need to give the massage after applying the moisturizing cream on the skin. Then back care is very much important, because the patient is continuously in supine position, means back of the body is continuously touching with the bed. So back care is very important. Continuously getting the pressure on the back side of the body, it will block the proper blood circulation in the back side. So back care will give more blood circulation by the back care. Special attention to the pressure prone areas we need to give, and every 2 hourly position changing and back care is needed, means we can give. Then soap we can use, wipe it with soap and rinse with the plain warm water we can use. Then dry the area by patting, not by rubbing. Especially continuously bed touching that body part, the skin is very much soft only. So rubbingly we cleaning the area, means peeling of the skin may will happen, is more chance is there. So sponge type of cleaning it's recommended, not by rubbing. Apply moisturizing cream and massage at least 3 to 5 minutes. Then by the massaging, after applying the moisturizing cream, it will help the increase in the blood supply, and it will most of all it will prevent the chance for the pressure sore also. Then active and passive exercise. Already the patient is in bedbound stage only. Maybe the patient will have the upper body strength, or maybe the patient is totally bedbound, means passive exercise. Actively, any exercise, if the patient is able to do, means we need to train them, or otherwise passively the family members need to train for getting the patient this type of passive exercise, because this exercise is very much important. All the joints need physiotherapy, so educate the importance of the physiotherapy or these type of exercise steps we need to explain, because we need to prevent the joint stiffness or contracture. If any food drop, any wrist drop, like that, anything happen, means it will more complicated for the patient also. Quality of their life will affect. So we need to educate them. Then another one, catheter care. So catheterization. What do you mean by catheterization? Catheterization means normally if the person is voiding the urine, means it's okay. But if the patient is unable to do void by self, because maybe the urinary retention, maybe the urinary incontinence. In both states, if it needed, means we will do the catheterization. Catheter is a sterile germ-free tube. It's a Foley's rubber tube, also rubber type material also there, silicon type also there. That tube that is inserted through your urethra and into your bladder. Tip of the catheter will be inside in your bladder through the urethra for draining the urine. These are all the types of catheterization. Mainly, we using the Foley's catheterization as a indwelling catheter, and silicon catheter also we using indwelling. Indwelling means inside we keeping that catheter for a while for draining the urine to outside. That's a indwelling catheterization. Next one, indwelling suprapubic catheterization. First one, indwelling catheterization through the urethra to the bladder. Here, indwelling suprapubic means to the bladder through the suprapubically. By a surgical incision, we will introduce this type of catheter into the bladder through the suprapubically and drain the urine. Third one, intermittent self-clean catheterization, ICC, means Nell cap type of silicon type of tube, mainly we using for intermittently. If the patient is able to do this process by self, means the process will be intermittent self-clean catheterization. Then condom catheterization, urocondom. This is a type of catheterization. It's a scene like on condom. It's at the tip on outlet is there. Through that outlet, we can connect the urobag connection tube also. This is the picture for the suprapubic catheterization and the indwelling type of Foley's catheterization. Procedure. All procedure should be in a sterile manner only. Take all sterile precautions while doing the procedure. Then maximum, first of all, we supposed to performing the catheterization for a person, means maximum smallest size, 14 size of catheter mainly in our practicing in here. First of all, by the doctor order, any size is recommended, means we can, otherwise 14, 16 or 18 size of catheter mainly using. Then before introducing, lubricate well the catheter by the jelly. It is important to ensure the bulb is in the bladder. We need to ensure, then only we need to inflate the bulb. Then how much to inflate? Anybody have any idea while doing the catheterization, how much ml of water needed to inflate the catheter bulb? Any idea?
Please put your answer in the chat box. Very good. 25 to 30 ml, 10 ml, 15 ml, 10 to 30. It is mentioned in the catheter, the catheter 30 to 50 ml capacity is. Catheter said 30 to 50 ml capacity is there for that bulb. 15 to 20 ml. I think it depends on the catheter size, but normally from 15 to 30 ml. Okay. Okay, thank you.
Thank you for your responses. Mainly is saying 10 ml, 10 to 15 ml, not properly only the 10 ml, 10 to 15 ml of distilled water we can use for inflating the bulb of the catheter. Too much inflation will affect the bladder also. Then in after the catheterization, urinary catheter insertion, the antibiotic prophylaxis anything is not much recommended. Any UTI history is there means only it's needed, not at all it's recommended after every urinary catheterization. This one is the intermittent clean catheterization, mainly NELCAT type of tube, silicon type of NELCAT tube mainly using for intermittent clean catheterization. For this process also, if the patient is able means we will make the patient to do this process by itself. For that, maintain the privacy for the patient or that person for making the dignity. Then wash hands, then position according to the comfortable level of the patient for doing the procedure. Then 12 size of NELCAT mainly using for this self intermittent clean catheterization. Before introducing the tube into the urethral orifice, we need to lubricate the tip before insertion. Proper lubrication is very much needed. Then mainly if the patient is doing the self-intermittent clean catheterization, we recommending every 4th hourly. That type of time schedule they need to maintain because their bladder need to train for this 4th hourly in between. Then clean the NELCAT after complete evacuation of the urine from the bladder. After the complete evacuation, need to remove the NELCAT and clean the NELCAT under the running water and keep it in a dry, clean container. This clean container also periodically need to clean in warm water, and maybe it's possible means boil the utensil also. Then after the cleaning we can keep the NELCAT inside the container. Proper cleaning before and after the procedure for the patient, their hand, their urethral area, proper handling of the tube, in between the lubrication before the procedure, after the procedure, proper cleaning, storage, everything, well hygienic procedure they need to maintain, or otherwise it will cause the infection chances for the person, that patient. What are all the main advantages of the intermittent clean catheterization? So already I told indwelling catheter means for a while period we placing that catheter inside the bladder. But here once in 4th hourly only the catheter moving into the bladder. Then after that it will coming out. So it's having some advantages also. First one, improve the quality of life. In indwelling means patient will feel they are carrying 24 hours for a duration of time. They are carrying the Euro bag along with the Follies. They need to carry. So here there is no need for carrying anything. So improve the quality of the life also. Then self-confidence and self-esteem increase, because if any travel, if the patient is needed means also with the Euro bag, if the patient is traveling means they are having some confidence problem also. They need to more care about their tube. But in intermittent clean catheterization, there is no need. Once in 4th hour only, they need to think about the procedure. Otherwise, they can move freely. Then easy to use also, because in between after the procedure, removing the tube. There is no chance for placing the tube continuously in the bladder through the urethral orifice or through the urethra. So there is no chance for any other complications, injury or any bleeding like that. So it's easy to use for the patient. Then inexpensive also. Comparatively, the Foley's catheter or any silicone catheter, this type of nail cath is very, very much cheaper than that. Then reduce the risk of infection also. If the patient is already in indwelling catheter means continuously the tube is inside the bladder only. There is a connection inside the bladder to the outside of the atmosphere by this Foley's catheter of the tube, because outside the tube to the tip of the inside of the bladder. So here at any where any infection chance is happening means it will affect inner system also. So there is more chance of infection. In already the patient is in indwelling catheterization, patient is not at all taking adequate fluid intake also, it will cause UTI, urinary tract infection. So these are all the main risk will happen in the indwelling catheterization. So these are all the risks we can reduce in the intermittent plain catheterization. Then improve sexual life also, because there is no tube there. So can improve their family life also. Then this one is the another condom catheterization or urocondom. This is same like condom only, but here at the tip one outlet is there. Through this outlet, same Euro bag for the catheterization only, same Euro bag we can use here. But here this Euro condom is applied outside of the penis. Because here one thing is there for male patient only, this Euro condom can use. And while using, we can connect the Euro bag that tube tip to the outlet of the Euro condom and can use. Here also some advantages is there. In other procedure, already the tube is inside the urethral orifice and inside it getting into the bladder. So here there is not at all anything introducing into the urethral orifice. We applying it outside of the penile region only. So less catheter associated urinary tract infection. There is no connection in between from outer medium to inner medium by a channel. So there is a less chance for the urinary tract infection. More comfortable than the indwelling catheter also. Because indwelling catheter means if accidental pulling by the person or while transferring the position time or while transferring from bed to anywhere, by accidental pulling it's happening means it will hurt the patient. It will cause the bleeding and other like type of complication. But here there is no these type of complications. Then less movement and restriction only, no restriction already needed. Suppose any pulling effect is happening means only this Euro condom will wear from there. That's only. Then non-invasive process also here. In catheterization, it's mild invasive process only, but here there is a non-invasive process only. Then some disadvantages for the Euro condom application type, because is having will get the chance for the leakage. Proper if the size of the Euro condom, mainly the Euro condom is available in large, medium, both sides it's available. Maybe the proper size is not at all using for that person means it will cause the leakage of the urine. It is the one of the disadvantages. Continuously the leakage of urine is happening means perineal area and other areas, or because the continuously touching the urine content on the skin, it will cause the any skin peeling and other skin irritations. It's the disadvantages. Then more likely to fall off or leakage or internal catheters, it's happening. Then allergic reaction also. It's already the Euro condom is a latex material only. So this material is allergic to the skin means it will cause the allergic reaction on the applying area. For fixing the Euro condom, adhesive tape only we using for fixing, tightly fixing on the area. This adhesive material also have any allergic issue already if the patient is having means also it will cause the skin irritation. While applying, we need to ensure for securing the tape is using means we need to ensure the tape is not at all touching the skin directly. We need to ensure on that. We need to cover only the urocondyle tightly by the adhesive tape. Then here on case scenario, I am just presenting. Just read it.
Can anyone please read it?
The home care unit of the hospital made a visit and they found that the patient was having pericatheter leak. So they changed the catheter. The next day, the carer noticed that the pericatheter leak was still persisting. She called them again and they came and changed the catheter. Again, the next day, the same happened. Once again, the catheter was changed. Okay.
The
The catheter was changed 3 times, but the problem did not resolve.
So what could be the problem? Can anyone say?
It could be the wrong size.
Okay, thank you. Any other problem? Okay. Fixation with tap. Okay. Catheter was small or too much of fluid. Okay. Muscle loosening. Which muscle? Friendly Sebastian is saying muscles loosening. Which muscle? Here the catheter was changed to 3 times, but the problem is not solved. Again, pericatheter leak.
So thanks for your comments. Here, around 3 times they changed the catheter continuously, but the problem did not resolve. Maybe this type of anything happen means we need to assess the bowel pattern also. First one, if the person or if the patient is already having any constipation history is there or not, we need to address on that. If the person having the constipation, prolonged long-term constipation, it will may cause the fecal infection. Anatomically, anteriorly, the urinary bladder, posteriorly, the large intestine. So the impacted fecal large content may will pushing effect will happen on the bladder and the neck of the bladder. So continuously the pushing effect on the bladder and the bladder neck will happen. The pushing effect of the urine also. It will leakage catheter wise. It will leakage. In another case means over inflation, because in already I told 10 to 15 ml distilled water needed for the inflation or the bulb. If suppose over inflation is happening means that over inflated bulb will continuously touching the inner wall of the bladder. Continuously touching of the inner bladder is getting us like a stimulation, and the bladder in between it will contract. So periodically its contraction, it will give a pushing effect of the urine from the bladder catheterally. So it's may will become on chance. Another one, UTA, urinary tract infection. Already the patient, if there is have any history of a urinary tract infection also, it will irritate the bladder layer, muscle layer. So if there is a no sphincter control is there, because already the urethral orifice, urethra, everything is opened by this tube. Then already the infection chance is there, or the infection is there, means also it will irritate the bladder layer also, muscle layer also. These are all the some of the situations the leakage of the urine will happen even in catheterized also. So we need to assess and we need to resolve. Then what are all the things as a bladder care we need to do? First one, in indwelling catheterization, if the Foley's catheter we using for the patient means once in 3 weeks to 4 weeks, means once in our setting we are practicing every monthly wise only we changing the Foley's type of catheterization. But silicone of catheter is we using means we can use up to the 3 months. Once in 3 months only it's needed to change the silicone type of indwelling catheterization. Then we need to provide the proper perineal care. So then keep the urobag cap always closed and below the waist level only. After the urinary catheterization, we need to ensure the urobag cap is, that outlet cap is closed. We need to ensure of that, or otherwise the air entry will happen and it will reduce the urine flow from the bladder to the bag. Then below the waist level, we need to maintain for tying the bag on the bedside. Then maximum 3/4 of the portion, half 1/2 or 3/4 of the portion of the bag is filling by urine only. We need to empty. Then proper intake of fluid also we need to maintain. We need to educate them. Maximum 2 to 5 liter or 3 liters of fluid within 24-hour patient need to take, even in indwelling catheterization. Then observe the urine is draining freely or not, any color change, any blood spot, any blood clot is there or not, we need to assess. Anything unusually happening means we need to report. Then encourage the patient for daily bowel movement also. Already I told constipation will affect the proper bladder output also. So we need to ensure that. Then, while telling about the care of perineum procedure, perineum should be clean after each act. Every after the defecation, we need to clean properly, and urination and defecation. Already in catheterization means after the defecation, need to clean the perineal area also. Then clean with the soap and water daily 3 to 4 times and keep the area very dry. And while cleaning the perineal area, clean from the cleanest area to the less clean area. From the urethral orifice, from there to the downward, it's rectal area. You need to clean. Then hands should be cleaned after giving perineal care. Then bowel care. Bowel care in bedridden patient means due to the lack of exercise and due to the less food intake, less fluid intake, and continuously some medication intake due to the interaction, that may be the cause for the constipation. Like that, any constipation history is there or not, we need to assess and we need to do the management. Then encourage the patient for bowel movement daily basis. Give the bowel movement time and space for the patient we need to give. And we need to encourage high fiber diet. If the patient is able, means we need to encourage to take high fiber diet and adequate fluid intake also. Then regular exercise we need to promote. It's very, and that's important, we need to explain them. Then bowel care, use bedpan. In bedbound stage means bedpan we can use, is mandatory, and maintain the patient. Privacy also we need to give. If the commode is possible or wheel commode wheels is possible, means we can provide and shift him into that and promote them for the defecation. If the patient, while our bowel assessment, some patient will say us like a constipation, some person will say us like a loose stool. If the patient is telling us loose stool means we need to assess. Maybe it's a spurious diarrhea. Spurious diarrhea is means a episode, multiple episode, a single episode of loose stool after a long-term history of the constipation. So due to the constipation, hard stool, impacted stool is there. From the loose that stool content, fluid content only is oozing out through the bowel. That thing they feel like a loose stool. So we need to address on that. That the constipation management is needed means we need to manage as like per rectal examination. According to the per rectal examination, any manual removal or digital rectal evacuation is needed means we need to do. High sodium phosphate enema is needed also. We can give the enema for flushing out the bowel completely and evacuation completely. Next one, nasogastric tube feeding. Majority of the bedbound patient, if the patient is unable to take anything by orally means for feeding purpose and for giving the tablet or a syrup form of medication, we will put or from other side only, we will get the patient is in the stage of nasogastric tube feeding. This is a process of feeding the tube inserted through the nose, pharynx, esophagus, and into the stomach. At most, the tip it will be in the stomach through the nostril. Care of a nasogastric tube. Perform hand hygiene before the procedure. Then give Fowler or semi-Fowler position. We need to give. Then before feeding, we need to ensure the position. Then prevent air entry while giving the feeding. So before opening the inlet of the tube, we need to pinch on the tip on the tube for avoiding the entry of the air. Then just for confirming the position, aspirate. If more than 50 ml of stomach content is coming means we need to skip the feed and wait for some time. Then food item, whatever maybe we need to give means thoroughly grinded and filtered. If any crystal part is in the feeding means it will obstruct the tube. So we need to avoid. Mainly we can say as like every 2 hours, 200 to 250 ml because this majorly this type of feeding is mainly happening anywhere. But in our setting, end of life care stage or terminally ill patient, for just maintaining the quality of patient, we recommending us 150 to 200 ml of with water, with flushing water, the food content, everything 150 to 200 ml once in a 2 hour. We making them to do like that only. Keep the after completion of feeding of that food content for just flushing 25 ml of plain water also needed for flushing the tube. Then keep the patient after the completion of feeding for 20 to 30 minutes. As well, 30 minutes we need to maintain the patient in that same position, semi or Fowler position we need to maintain. Then only if it necessary means change the position. Provide oral care also. I told even patient in nasogastric tube also oral care is very much needed. So we need to do and keep the moisturizing effect in the inside the oral cavity and the lips also for avoiding the cracks and the dryness. Then for fixing the tube on the nose tip, we mainly using the adhesive tape for fixing. Periodically, we need to change because we need to prevent the ulcer formation and the skin peeling.
Catheter care in males. Articles required.
Thank you. Thank you all.
Thank you, Sajan, for the detailed presentation. Anybody have any doubts on this? I hope this detailed session to refresh your knowledge again. Anybody?
Yes, I do
please.
have one question. So for mouth care, you mentioned normal saline solution and sodium bicarb solution. Are there occasions where one is better to use than the other?
Could you repeat again that question?
Sure. For mouth care, you mentioned making a sodium bicarb solution and also normal saline solution. Is
Yes.
there when do you use sodium bicarb and when do you use normal saline?
For normal, no, if the patient is having too much plaque and bad smell is there, we use sodium bicarbonate solution. Otherwise, we normally use that normal saline.
Okay, thank you.
So, if anytime, whether you use normal saline or soda bicarb solutions, after wash with that, you have to clean the mouth with normal water. So that is must.
Self-catheter, in self-catheter, how long could the nail catheter be used?
Ma'am, your voice was not
Oh,
clear.
sorry. Self-catheterization, in that, the nail catheter, how long can that be used?
Self-catheterization,
The catheter, how long can that be used?
catheter, Foley's catheter.
No, self-catheterization. For self-catheterization, intermittent
Yeah.
self-catheterization, that catheter, how long can that be used for?
Yeah, so one catheter, we usually give 4 catheter at a time. One day, first they have to use the first one. After that, they have to wash the catheter and keep it in the container. And the next time they will use the next catheter.
Okay.
So 4 catheter, they will, at the 1 week, they will take it. And after that, we will give
Fresh
another
ones.
pair. Yeah.
Okay.
Can we use betadine for that? What? Sushma, ma'am? Sony, what is VAP?
Ventilator associated pneumonia.
Okay.
Ventilator associated, yeah.
Okay. And again, Sushma ma'am is telling that when we do female catheter, definitely you should not use spirit. You have to use when we do the perineal care or the catheter, when we do the catheter insertion, that time you can use betadine. Otherwise, no need of betadine. You can use soap and water for cleaning the perineal area. But in hospital, we use normal saline and betadine. If you use betadine, you can use better. You can use diluted betadine, diluted with normal saline. So here today we lot of things we have discussed about the basic nursing care. Why we are discussing here is in palliative care we have seen lot of bedbound patients. But within the hospital, we all are there. The nurses, doctors, and other healthcare workers are there for taking care of them. But when they go home, who will take care of the patient? So you have to think about before they are discharging from the hospital, before they go home, you have to train the caregivers. Okay, so instead of telling or instruct the patient, you have to demonstrate. For example, changing of bed sheets from a bed-bound patient. They don't know. They usually pull the sheets under the patients. Their idea is good because they need to change the sheets every day. But they don't know how to change a bed sheet from a bed-bound patient, how to put a new sheets. They used to pull the sheets. That time there is a chance of peeling of skin. If you not give much attention on that area, definitely the skin will break down and again beds of formation will be there. So that kind of things you have to demonstrate them, and also catheter care. So they don't know how to take care of a police catheter. They have to change, they have to come for changing the catheter. If possible, you have to arrange a home care staff for arranging, changing the catheter. And catheter care is also important. They usually, without hand washing, they will touch the Euro bag, that they'll disconnect the Euro bag from the catheter. So these can cause urinary tract infection. So these all things, if you train the caregivers properly, definitely these all urinary tract, these kind of urinary tract infections can avoid. Because if the patient is on urinary catheter, the Foley's catheter, this is one of the foreign body in the bladder. There is a chance of urinary tract infection. So there are three major three important things they have to maintain, because for preventing urinary tract infection, they should maintain proper perineal hygiene. They should take oral intake, because if they take proper oral intake, that way we can able to prevent urinary tract infection. And the third one is bowel movement. If the bowel movement is not adequate, that lead to urinary tract infection. And another problem is urinary leakage, because when the fecal impaction is there, the fecal matter is impacted in the bowel, that will compress the neck of the bladder, so that the urine won't be able to come out properly. So with that time, the urine will leak through the side of the pericatheter region, the side of the urethra. So catheter, again, pericatheter leakage is there. The third one is urinary tract infection. The recurrent infection is also. So these are the things you have to tell the caregivers for preventing urinary tract infection. And Sajan was telling about the inflation of the catheter. You were saying different that amount, 30 to 50, 20 to 30, 15 to 20. So 10 ml is ideal, 10 to 15 ml is ideal, because if you, why we are inflating the catheter, that we have to think about. Only thing, this catheter should hold the catheter, should be inside the bladder always. So that things, only 10 to 15 ml is enough. If you inflate more ml, that catheter is at 30 to 50 ml, that is the capacity of the bulb, but we don't need that. So if you inflate too much more, if you inflate 20 ml, so what happened is bladder spasm. This bulb will touch the bladder mucosa and the patient develop bladder spasm. Okay, what you have to do is, if the patient can develop bladder spasm, what you can deflate the bulb and wait for some time, and then you can, after subsiding the bladder spasm, then you have to reinsert the catheter. Okay, that way we can manage. And the another thing is nasogastric tube feeding. Why most of the nasogastric feeding patients is getting aspiration pneumonia? Why it is happened? So one of the most common complication of nasogastric tube feeding is aspiration pneumonia. Why? Anybody? Any answers? Incorrect position while feeding. Position. Pushing the feed. If you feed incorrect, feed the patients in supine position, what happened? Regurgitation. Displacement of feeding tube or aspiration. Okay, maybe. Yeah. My question is why the patient is developing aspiration pneumonia. So thank you. Position after feed. Yes, definitely we need to. Sajan has already said we have to maintain the same position after the feeding at least 30 minutes. So when we insert an nasogastric tube, what is the anatomical changes happen in our body? So normally, if you eat something, after that, if you develop a regurgitation, it won't come back because of our gastroesophageal sphincter. When we insert an nasogastric tube, what happened? The gastroesophageal sphincter is always open. After feeding, when they regurgitate, the stomach contents will easily go out through the sides of the sphincter because the sphincter is always open because of the tube. That goes to the trachea and the patients will develop aspiration pneumonia. So before feed, you have to maintain semi-Fowler's position or Fowler's position. After feed also, they have to maintain Fowler's position at least for 30 minutes so that we can prevent aspiration pneumonia. So aspiration, if we prevent aspiration, definitely we can prevent pneumonia also. Okay, so this is the important message you have to convey with the caregivers. Otherwise, they will feed in supine position. If they feed supine position, what happened? This is the real problem is happened for them. And the another thing is after feed also they have to maintain the same position. That important message is also you have to convey. Okay, and the fixation of nasogastric tube. We always fix the nasogastric tube on the bridge of the nose, but no need to fix the tube always on the bridge of the nose. You have to fix it on either the cheek, right side of the cheek or left side of the cheek. Okay, so that we can prevent ulcer formation. Okay, any other doubts? Time up. We can wind up the session. If you have any last minute question, we can take. Otherwise, we can wind up. Okay, thank you. Thank you, Sajan, for the detailed session.